Thank you for doing. Thank you for joining us today. We are so happy to be here. We have people from so many different areas around the Southeast region who is here so we can continue to move this amazing work that you all are doing, moving it forward. One thing I know about us as CHWs and allies, we are not giving up. We don't give up. We whatever comes in our path, we tackle it, we make it happen, and we make the difference that we need to make in our community, right? And across the Southeast. So I want you all to, give yourself kudos, clap, give yourself a hand clap because you're doing amazing work that we're seeing that you're sharing in the different platforms that we have. So we're so grateful for you. And just to be here every month, it's like a whole nother layer of motivation that we need during this time, that we need a whole layer of motivation, another layer of the why we do this and why we're here. So I'm grateful for you all. And Temple from Georgia, yes, good to see you again. So again, thank you, welcome. I know some folks will definitely trickle in and be here as the time goes on. So, I'll put it in the chat again for those of you who just joined in. If you could put your name, your state, and if you're CHW or ally, feel free to put that in the chat so we can acknowledge you while you are here. Okay. All right. So without any further ado, I'll pass it over to Christine, who will introduce our speaker. Lisa from Florida.
Good morning, good morning, good morning. I have the pleasure of introducing Rich Strader to us. He's no stranger to us this morning, but Rich, however, is a research and communications lead here at CHW. He's worked with CHWs as a ally since 2020. After serving as a Peace Corps volunteer in Mexico, Rich began working with PASOs in 2020 as an AmeriCorps Vista. His work expanded to a joint graduate assistantship with the Center for Community Health Alignment in Pasos in 2021. Rich held this position until graduating with a Master of Arts in Anthropology in 2023. He began his full-time work as a research and communications coordinator with the Center for Community Health Alignment in 2023. And he utilizes his skills as a mixed methods researcher and marketer to better understand the lived experiences of CHWs across the U.S. and leverages such knowledge in marketing and communications campaigns to support the implementation and advancement of the CHW workforce. He tries to center the voices of CHWs in all of his work, advocating for the philosophy, nothing about us without us. Without further ado, I'd like to present or introduce, if you've not met Rich, Rich Strader to our meeting this morning. Thank you, Rich.
Thank you so much, Christine. So I am going to go ahead and share my screen. Can everyone see my screen today?
Yes.
Yes.
Great, great. And if at any point anyone has any questions, feel free to come off mute. If someone doesn't mind monitoring the chat, I'm able to see the chat right now, but feel free to ask questions, interrupt. So as Christine was mentioning, my name is Richard Strader. You can just call me Rich, and I am a CHW ally. I want to start by saying thank you. Thank you for being here today in this space with us. I imagine there's a variety of other meetings you could have attended. Thanks for being in this one. So going into a little bit about our work, you may have noticed from my background in these slides that I work for the Center for Community Health Alignment. So our tagline is getting to the heart of community health. The center is a community engaged organization supported by the University of South Carolina School of Public Health. Our network of partners work alongside leaders to align efforts addressing health inequities in South Carolina and nationwide. our collective experience as CHWs, or in my case, as a CHW ally, is rooted in uplifting CHW voices and self-determination. This is central to our work as a nationally recognized leader in CHW training and technical assistance. So today we're going to be talking about the South Carolina Community Health Worker Prioritization Index. So this is a tool that we can use to identify priority areas for CHW employment. The objective is to support health equity by pinpointing communities with the greatest perceived need based on the data that we have available to us. And to clarify before we go any further, I want to just say all communities can benefit from CHWs. What this tool does is helps us identify which communities, based on the data, can benefit the most. But before we go into more about the tool, I want to hear from you all. What does health equity mean to you? And how can we use data to advance health equity? So whenever you're ready, you can come off mute, or if you haven't already, share your name in the chat if you're a CHW ally where you work, and then share a little bit about your perspective. We're going to take a few minutes to do that. And again, I'm not able to see the chat, so if someone doesn't mind helping me out reading what we've got going in the chat.
Yes. So Francine said, identify needs and show impact.
Okay, great. Thank you, Francine. Anybody else? Anybody feeling brave, want to come off mute? What does health equity mean to you, and how can we use data to advance health equity? Nobody wants to talk to me? Do we have anything else in the chat?
We just have introductions in the chat, but it was just Francine for now.
Okay. Well, if anybody thinks of anything along the way, feel free to chime in, either by raising your hand or putting something in the chat. Okay. I see we've got somebody raising their hand. Go ahead.
I'm Megan Bell. I am at the University of Alabama at Birmingham, and I'm a librarian, and I'm a CHW ally. To me, health equity is giving people what they need in order to have, good health outcomes. And data can help us figure out like what communities we can look at health outcomes in different communities and see who needs to help the most. And I think data is a way to kind of help justify why you're doing a way to justify decisions or support decisions.
Thank you so much for sharing that.
Yes. We do have more. Lewis mentioned it is important because data can prove arguments. And then we have Bria said, health equity means everyone getting the health and medical care and social support that they require to get the best health outcomes.
Okay. Anybody else before we move on? Okay. Well, thank you so much to those of you who shared. Thank you. Thank you so much. So now I'm going to talk about the nuts and bolts of the index. So starting with where you can find it, you can visit the CHW website, the Center for Community Health Alignment website. And if you go under this menu item here about CHWs, there is a drop-down option that says South Carolina Community Health Worker Prioritization Index. If you click on that option, it'll bring you to this page that you're seeing on your screen right now. There are two maps on that page. The first one on the top is got the data presented by zip code, and if you scroll down, you'll see the data presented on the county level. So talking now about how we've developed this index. This was a collaboration with the South Carolina Center for Rural and Primary Healthcare, or CRPH, at the University of South Carolina School of Medicine. They were able to collect much of the data we have and did some of the analysis, I had the pleasure of creating the maps that you see on that page using ArcGIS. I'm so happy to talk more about that process if anybody has any questions at any point. The data sources, I want to start by saying this is using cross-sectional data, which is really just a snapshot and one moment of time of the data that we have. So that's one potential limitation to think about as we go into this. It's just really a snapshot. We know that data is always changing. The data that we are pulling from is coming from the Census Bureau, the American Community Survey in this case, the South Carolina Revenue and Fiscal Affairs Office, the South Carolina Department of Health and Environmental Control, now known as the South Carolina Department of Public Health. We're using data from their SCAN, the South Carolina Community Health Assessment Network, and then some data from Health Resources Service Administration. I'm just going to briefly talk about some of the data. There is a comprehensive list on that webpage, but some of the data we looked at is uninsured rate, income per capita, poverty rate, and then some health indicators from state health data, such as diabetes, hypertension, among other. We've also got the licensure data for healthcare providers, as well as counselors that we're considering in this index. And then the number of federally qualified health centers or community health centers per 1,000 residents. That data is coming from HRSA. So as I was mentioning, you can find a comprehensive list at the bottom of the page below the two maps. All of the data that is publicly available is linked, hyperlinked in the text. The only data that is not publicly available that we have on this index that we're not able to link is the data coming from the state, from Revenue Fiscal Affairs. But that is included in both of the maps. And then below those data sources, there's notes if you're curious about the data. So many of the rates, all of the rates were calculated based on per 1,000 residents. There's some details that I'm not going to go into for the sake of time there. If you're interested, and if you have any questions, feel free to reach out. So now I want to hear from you all again. If anybody wants to come off mute or talk in the chat, I'm curious to know how you use cross-sectional quantitative data in your work, whether that be census or state health data.
I'll go back. There was one more about the first question.
Okay, please go ahead.
Yes, Bria mentioned that data helps us understand if our community members are receiving the overall health care that they deserve.
Okay, thank you so much for sharing that.
Yes.
Do we have anything else in the chat?
That's it for now.
Okay, I see Shantini has her hand up. Go ahead,
Yeah,
Shantini.
I love the cross-sectional data because it gives you like the lay of the land, what's happening at the macro level. And then you could overlap the data that you find with the information that is happening right here in my community, and how does that relate, or how does that compare or intersects with what is happening at the national level. So I could think about how we have been using that for the purpose of applying for grants, right? We see that XYZ zip code has this incidence, but let us look deeper. Let us draw into what is the reality. So thank you for bringing this information up and maximizing or amplifying how it can be applied and how it will be used.
Yeah, thank you so much for sharing that, Shantini. I definitely think this can be used in applying for grants, as we're able to show what's going on based on the data we have, the cross-sectional data from that snapshot, to advocate for advocate for interventions and implement programs. Anybody else have any comments in the chat or feel like coming off mute?
Yes. Erica said, I use it for community health data walks, health improvement plans, and health needs assessments.
Thank you so much for sharing that.
Mhm.
Okay, well, if there's no one else, I think we're going to
Oh,
move on.
we have
Go
another.
ahead.
Amanda mentioned similar. We use this disaggregated, I hope I'm saying it right, disaggregated data, always required for our grant applications.
Great. Thank you as well for sharing.
Aggregated, there you go, disaggregated.
Okay, disaggregated.
Yes.
Thank you. Thank you all for sharing. So now I'm going to talk about how you can utilize the index. So looking specifically at the box, if you're clicking CHW index on the zip code level or on the county level, we've ranked that from 0 to 1, 0 being the lowest, 1 being the highest. If you're looking to zoom in to particular parts of the state or particular counties, you can select the plus and minus at the top of the map, or if you're like me, you can use the wheel on your mouse and then have the control button down at the same time. If you're looking for data on a particular zip code or county, you're able to click that on the map. Legends are available both under the boxes as you're checking them for data, and then as well as in the top left of the map. Depending on the area that you're viewing of the map, you can identify priority areas of the state, region, or the county. And then you're able to filter using this map for lower or higher population areas if you're interested in that. So this is what those features look like. So you're able to zoom in and out using these buttons here. Or like I said, if you have a wireless mouse or maybe even a wired mouse, you're able to use the wheel there using the control button to zoom in and out. And then looking at the zip code map, you can click on individual zip codes and it'll give you the index scores as well as the population and which zip code you're looking at. And you're able to do this for all of the data we have on these maps. So quick note about this data. So for ED rates, what we decided to do is look at the number of visits per 1,000 residents as it compares to the state median for South Carolina. So if you've got a number that is high, this is above the state median versus a lower number is below the state median.
I'll also add that Shantini just mentioned that I also use it in our CHW training to educate people about the highest needs. Example, 10 deadly diseases affecting state, county, and etc.
Thank you for sharing that, Shantini.
Mm-hmm.
As I was mentioning before, you're able to look at the legends for each of each data set we've got on these maps by clicking under the boxes, as well as going up into the top left. There's a legend button there as well. And the last thing before I move on, if you're looking to really focus in on a particular part of the state, you can zoom into that area of the state, and it'll give you data on just that specific area. So in the case of the index, we see that we might think about focusing on zip codes that have a population above something or below a certain number. And as we're doing that, we can identify for all the zip codes with a population over 1,000, For example, these zip codes have the highest priority score. And so to filter by a specific region, we just click on the filter map extent button. And then we can filter out certain populations based on the size, if we want a smaller or larger population. So this is with all the zip codes below a population 2000 that have been removed from the table that generates at the bottom. And as I was mentioning before, we're able to, once we filter, we can adjust the map extent again to give us data on just that region of the state. So another thing that you might think about doing if you're in South Carolina or you're able to develop a similar context in your state is leveraging this data for specific program focuses. So diabetes, hypertension, low birth weight, or other health disparities, because we've got other data on these indexes. So that's something you're able to do as well with the maps that we've created. So here we're looking at diabetes rates by zip code across South Carolina. And again, you're able to filter by map extent if you're looking at diabetes rates, just in a particular part of the state, like the PD or the low country, and filter by population. So maybe we want to look at zip codes that have a population of 5,000 or more. That's something you're able to filter out or focus in on using this map. And then as you see here, you can sort by ascending, descending, whatever fits your purpose. So here we see that maybe statewide for zip codes with a population over 5,000, we've got Walterboro is showing up in the data as a higher rate. But if we wanted to look at the PD or the Grand Strand area, we're able to filter by that as well.
So Francine just mentioned, do you know of any other states that have a CHW prioritization index?
I do not know of any states that have prioritization index, and the zip code level data is also not something I know a whole bunch about. I have seen a whole bunch. But if you have any specific questions for your state, happy to talk with you about how we can work together on that. And then the last example I have is birth weight. So we're able to pull birth weight data from South Carolina Department of Public Health and then identify by zip code the number of low births, percentage of low births for zip codes with a population above, I think in this case, I'm looking at 5,000. Shantini, go ahead. Please.
So this is awesome. I'm curious, is this only for South Carolina? And if so, I guess the follow-up question is, how can we create like a central hub where this information is also unique to each state?
Yeah, so far we just have South Carolina for the prioritization index, but we could of course look at options for developing similar indexes in other states. Many of the tools that we're using are available nationally. So the census, of course, is nationally, but also um, the South Carolina Community Health Assessment Network is using national practices to collect that data. So there are similar systems in other states that we're able to draw upon to get that data in a different state. I imagine there are some differences between states, but for those pieces of data, uh, we can certainly talk about how that's done. The the licensure data that we are using and the data we have from our state health office of Revenue Physical Affairs is unique to South Carolina, and I imagine that other states have different systems for calculating that.
So Lori just said the Tennessee Justice Center has a health equity dashboard that has similar information in a very accessible dashboard.
Great. I'm curious to see that. Would you mind putting that in the chat?
Mhm. And Honey just mentioned, this reminds me a little of the social vulnerability index through CDC.
Yes. So it does have some similarities with that, as that it's really granular. It's focusing on, I think the social vulnerability has census tract data. Um, One thing that we're not capturing a lot here are social terms of health. So this is a lot of clinical data, a lot of, as I've already mentioned, census data, surveillance data from our health departments. Um,
Mhm. And
I
Lori just added the link, and so did
thank you
Shantini.
so much. So that is that is one way it's different. It's not gathering the social terms of health like the social vulnerability index is. And that's a room for expansion, definitely, in our context. Anything else before we move on? Um, we are running out of time here. I think we've got about 10 more minutes. So just to summarize, the index is a tool we can use to prioritize areas for community health worker employment. As I was mentioning before, it was developed through a collaboration with CRPH and CHW. I had the pleasure of making the maps in ArcGIS. We've already talked about the data sources, um, and we can use this data to look at focus areas like diabetes and hypertension. So some of the limitations are, as I just mentioned, that we're not capturing that social terms of health data with this data. It is a cross-sectional data, so it's just a snapshot. We know that data is changing over time, communities are changing over time. So that needs to be taken into consideration. And another is that taken as a whole, the index isn't placing emphasis or weighing to a particular indicator. So if we're looking at a particular focus, the CHW prioritization index score isn't necessarily going to show us which zip codes have the most uninsured or most um, diabetes visits, diabetes rates. That needs to be considered as well. So with our time, I would like to hear from you all. Thank you so much for sharing what you have already. Uh, Anybody want to talk about how the index is reflecting the challenges that you're encountering in your communities? Is this doing a good job of capturing that? Feel free to come off mute whenever you're ready or type in the chat and someone will hopefully read it out to us. Do we have anything in the chat, Soledad?
No, just links. Shantini just added another link.
Thank you for the links. Okay, well, maybe we'll come back to that. I'm curious to know which aspects of the index is most relevant to identifying the community health needs in your context and why. What really stands out to you about this index as useful and as indicative of what's going on in your community?
Um, Hi, this is Lori. Um, I I feel it's helpful in terms of figuring out where we want to do our work. There's always so much work to do. We often don't, we don't have the luxury of looking for where the need is greatest because there's so much need. But I find when you are trying to write a grant or educate someone in your state or elsewhere about where the need is, that this data and this dashboards where you can really get down to zip codes and neighborhoods is very helpful. We know there's a lot of need out there, and these help us pinpoint where they are, and leading to more services in those areas is nice, but it's also often that we're doing the work, and then this work helps us justify which, that our area is an area of need.
Okay, thank you so much for sharing that. If you don't mind, I'm curious if you can speak to what part of the index in particular you think is going to be helpful, or maybe in a similar context in your state, helpful.
Just basically having data from several sources in one place that shows, if infant mortality rates, and there really is a difference. One of the things that the Tennessee Justice Center dashboard shows is deserts, maternal doctor deserts. So you can look at a map and it's color coded. You can see by the color code where most of the state are in deserts for certain types of health professionals, such as maternal child health. They'll do the same data for hospitals. They'll look at how many hours it takes to get to a maternity ward from certain parts of the state. So it's a lot of information, and it really helps you, and it's taken from various places, so it helps you see very quickly.
Okay, thank you so much. I'm definitely gonna have to check that out. That sounds fascinating. Thank you.
They just unveiled it last year.
Okay, anybody else before we move on to my final question for you all? Do you have anything in the chat, Soledad?
Yes. So, Lily mentioned this information is very helpful. Not only does it identify the needs, but also provide resources to address those needs. And Rebecca mentioned the map helps to make the data more real in a way, because even though we see it on the ground, it becomes more intense to see. Oh, it just moved up. Okay. We see it on the ground. It becomes more intense to see the colors of how real it is. Then Cindy just added that this is very helpful with potentially eliminating survey exhaustion, right? Where the community has been questioned over and over what their health needs are.
Yeah.
Yeah.
Thank you both. Yeah, this has been a huge pleasure for me I'm a very visual person, so having this map has been fantastic. Having lots of fun putting maps together. Okay, and so my last question is, we've already mentioned a couple different data sources. What additional data or qualitative insights? If you know me, you know I'm a big fan of qualitative data. What qualitative insights would you suggest including in an index like this to enhance accuracy and usefulness? What is it missing? What do we need? Francine?
Yeah, so I was just gonna ask, are there plans to include cancer related data or behavioral data?
And when you say behavioral data,
So like things like health things like that you would find in the behavioral risk factor surveillance system.
okay. Uh, Something that was a challenge for us to try to identify was the availability of counselors across our state. So the licensure data we have is we feel it's quite limited, and that is perhaps because the way that the state is providing licensure to counselors in our state is quite varied. There's a variety of options for licensure for counselors, so that makes it difficult for us to examine um, where there are counselors in our state and to what degree they're serving communities who are experiencing behavioral health challenges. How are we looking on time, Kristen y Soledad?
Think 1 more minute.
Okay.
Yeah.
Thank you all so much for sharing. I hope this has been helpful, and I've certainly enjoyed hearing about what's going on in your states. Feel free to reach out if you have any questions or if we can help you with anything. So yeah, technical assistance is something we offer. These are a few things we have: collecting and analyzing data, implementing CHW programs, integrating CHW into care teams, evaluating programs, and then communicating and marketing for diverse audiences. So that's something we can help with. And if you aren't already on our mailing list, please join our mailing list. You can scan this QR code and then go down to the bottom of the page. If you are not already following us on social media, you can do that as well. Here are the handles for each of those. And I'm going to share this presentation with the group. So this will be made available to you if you have anything you want to look back at. That'll be up on our website soon. Thank you.
Thank you so much
Thank-
for that, Rich. Oh, so that, sorry.
Oh, no, I was just saying thank you.
Yes, and if anyone has any other questions or if something, you know, comes to your head before we end today, feel free to drop that in the chat for Rich. And so that you are up next with updates.
Okay, thank you. Thank you again, Rich. I'm so happy that this information is being shared. Thank you again. I would like to share. Let me share my screen. Okay. Our summit that is happening on September 18th and 19th. Okay. It will be in Kentucky. Let's see some of those party emojis. Let's see the clapping hands emoji. So that is happening later on this year. So this is 2025 summit, and we are going to be in Kentucky, and we are collaborating with the Kentucky Association of Community Health Workers. In other words, kayak. And we are so excited to partner and just to be in a room with everybody. Once again, this will be a bigger scale, bigger turnout. So we are just super excited, but stay close to your emails. We will be sending out more details as far as registering and sponsoring if you're interested. So this will definitely be the opportunity to do that. Any questions before I move on? Anyone from Kayak want to say anything? And yes, it will be in Lexington, Kentucky.
I have a question.
Yes.
Are you guys, the Southeast usually has its own conference. Are you blending this year? So you won't have one later in the year?
Right. We're blending together. We're combining together. We're doing this together. So this will be the only summit during this time for the Southeast Network. Yes. Okay. Let me stop sharing. Another thing I want to, do I have to save the dates? Yes. We will be sending that out. Thank you, Erin, for putting that in there. Yes, Louis, we will be sending that out. Also, we have our strategic direction team. We are going to have our first meeting for the year in the month of March. Okay, so look out for that email. And anybody else here, if you are looking forward or would love to be part of the strategic direction team, and basically what we're doing is taking all the information, every detail that we get from the Southeast. We have priorities that we're focused on, which is, you seen the logo, that was part of it, social media, the governance, reciprocity. So there's so many different important subcommittees that we have that you can be part of the conversation and support, and supporting throughout the Southeast. So it's not just catered to just one specific area, but we do have so many different how can I say this? We have so many different individuals from different areas who need support, right? They need help. They need the support from the Southeast, and you could be part of that change that we're trying to provide to these other organizations. So if you would like to be part of the strategic direction, which is part of the Southeast Network, feel free to put your email in the chat, and I will make sure, or just send me an email, directly in the chat. A message in the chat, and I will be more than happy to get you connected and make sure you're part of the calendar invites that we send out. Another thing that I would love for everybody to actually put on your computers right now, the My Envision app, where we have a channel specifically for the Southeast Network, And this is where we are putting any information, any events that you have going on in your state and would like some support. We want you to put your information and details in this app, where we have so many people from throughout the Southeast who is participating, who is sharing our information. If you have a summit coming up, like I know CHW Strength, they have one coming up. We want to see your information out there to share with other people. I actually have it out here, have it up on the screen now, and I did put the link in the chat so you can click on and register to join this. This is an amazing space. Not only are you limited to this space for the Southeast Network, you see we have our own channel. You can connect with other CHWs from around the nation, I want to say. So around the world, okay? You can connect with so many different people. They have a space for CHWs and space for allies. Any events, like there's the March CHW collab. Rebecca put her event up here, right? So we're not just keeping the information just for us. We have to let other people know, right? So you come in here, you could register for the event, get some more information for the event. If you're looking for CEUs, you can go into this app or this platform to get more information. I'm clicking on the CHW area. We have Honey who look at this, put in the information about North Carolina Community Health Worker Association. We are loving the information that you're seeing, more information on APHA. So we don't want to leave anybody out, right? So come on and click on that link and learn some more of what's happening outside of just your state, right? Sometimes we could copy what somebody else is doing, right? Because if it's benefiting them and we know we need that help in our state, we could take it and do the same thing, right? And you could reach out to different individuals who are just doing amazing work in their state. So, a lot of times we don't know what else we can do or how to start something. And this is one of the areas or the places that you can get that support in. Okay, upcoming events, there's a whole bunch that you can look into, okay? But more I also took some information that was given in the chat today. I put it in the Southeast Network of the links that Rich was speaking about during his presentation. So I just wanted to put that out there. I think from this meeting, I got one ding. So I want to see a couple of more because I do hear them when they're coming in, and then you will get accepted. I know it's going to take a little time for you to get approved to come into the group, but you will get approved to come into the group. So that's all I have to say. If there aren't any other questions, I want to pass this over to Christine.
Got it, Soledad. Thank you so much. Next, we'll have our state updates. We initially decided to divide the group up, and so by monthly, each state will be reporting out. We have Arkansas, Florida, Georgia, North Carolina, Kentucky, and Louisiana for today. However, if we move through those pretty quickly and your state was not listed and you have an update, please feel free to share. First up, we have Arkansas.
Good morning. This is Anna Huff Davis. I don't know if Judy is on. Judy, are you on the line? Judy Powell, our
Judy had
director.
a scheduling conflict. She did tell
Okay.
me that, so you're welcome to report.
Okay. Well, I have a couple of things to report. We had our day at the state capitol on February 12th. It was rainy. It was cold. It was all kind of inclement weather, but I think we were very successful. We had a short program in the rotunda, and then after lunch, we went and visited with our representatives. We had 10 meetings that were scheduled, and the representatives were very receptive. While we were out at the rotunda, we had several informal meetings with representatives that came by, and so it was very successful. We had about 70, I think Judy said there were about 80 people in attendance. So we were very excited about that. And also, we had a legislator there who had drafted a bill for us in regards to CHW certification and also in regards to reimbursements for services. And so that bill made it out of committee, and so now we're going to both of the houses, well, the House and the Senate, and see what happens there. And we're just very optimistic and very hopeful in regards to what's going to happen. So we're excited here in Arkansas. The movement is, we're on our way. Thank you.
Thank you so much for that update. Thank you so much. We will move on to Florida. Is anyone on from Florida with an update?
Hi, good morning. Lisa Hamilton here for Florida. We had our CHW Awareness Day on February 10th and 11th. We now have a bill in the pipeline, Senate Bill 850 and its companion 719. It is gaining support based on the calls and requests for us to come back to the Capitol in March. And so we're excited about this progress, and now the work begins as we go through committees. And so pray for us here in Florida. Thank you.
Thank you so much for that update as well. Next, we will move to Georgia.
Yeah, I don't know if anybody else is here is from Georgia, but I can start. I think I saw Temple, a couple other people were here, but we did also, I think that week of February 10th was a very busy week because we also had our CHW Day in Georgia on February 11th at the State House. And so we did meetings with our legislators. We did also do a program where we had some folks from the Rural Health Association as well as some faith-based organizations doing community health work, do presentations. We were there really advocating for CHWs and for Medicaid as well. And we also had a bill pending. It's House Bill 291. It's related to the building the foundation for credentialing certification in Georgia. And so it made it through committee. And during the debate, they had so many questions about CHWs. They tabled it, but then they picked it up again yesterday afternoon. And I haven't heard what the outcome was, but what happened was there were some amendments made to the legislation, and then there were some information gathered for the legislators who asked questions. And so that all happened late yesterday, and I haven't seen anything yet today for an update. The network, continues to build in Georgia. There's a state CHW advisory board that continues to meet, and I think there's some statewide and regional meetings coming up. I just don't have all the updates available because I'm doing this off the top of the dome. But thank you all so much, and I don't know if Temple or anybody else from Georgia can add anything.
No, thanks, Darrell. That was a great recap.
Thanks, Darrell. We will move right along. North Carolina.
All right, what's good, everybody?
Hey,
It's good to
hey,
see
honey,
you.
honey, before you go, right?
Yeah.
Let me just a funny story. So I've been down here in Georgia since 2018. So we moved a couple of years ago, and I meet my new rep. And so I say I'm from Boston, and he has roots in Dorchester, Massachusetts. So my current state rep in Georgia has roots in my old hometown in my section of Boston where I used to live. So talk about a small world. All right, honey, here's the mic. Love you. Peace.
Thank you, Darrell. So we've got lots of things happening here in North Carolina. Most recently, we have surpassed 1,350 certifications issued in North Carolina. So we're really proud of those numbers. Our first batch of CHWs are coming up for recertification very soon. So we've been doing a lot of technical assistance with them and providing support and getting them to continue engagement for recertification. So we're really excited about that. We also have been doing a lot of work, Dulce Ortiz, through our regional networks. And so continuing to engage CHWs a little bit locally. So we're very excited about the momentum that we're creating there with our regions. I am very excited to share that we've got our CHW Summit coming up on April 2nd and 3rd in New Bern, North Carolina. So we're very excited about going into the East. And if in case y'all didn't know, New Bern is only like an hour away from the beach. So, if you need an excuse to go to the beach, come join us in April. We're very excited. Denise Octavia Smith from Nashua is going to be our keynote. So we're very excited about her joining us. And then we have our Advocacy Day. This is going to be our third annual Advocacy Day. It is scheduled for May the 13th. So if you are a North Carolina CHW here on the call today, May 13th, put this down. We'd love for you to join us. And to answer your question, Darrell, recertification in North Carolina is every 3 years, requiring 24 contact hours, not CEUs, contact hours. Because it is hour for hour there instead of this weird kind of math you have to do with CEUs and contact hours. We want to make this process very, very simple and seamless for CHW. So 24 contact hours. That is what's up here in North Carolina. We'd love to see you in all of the places. And my facilitators, Soledad, Christiani, back to y'all.
Thank you so much, honey. Thank you so much. And I love that energy. Next, we have up Kentucky.
Hi, my name is Casey Rhodes. I am from the Kentucky Office of Community Health Workers. I don't see anyone from Kayak, but I have some updates from the Kayak. So the next quarterly Kayak meeting is May 7th, and another shout out to Denise Octavia Smith from NACHWA is doing a training on public speaking advocacy for the CHW role. And as we talked about earlier, Kayak is also working with the SE network to plan the conference in September, which is really exciting. And we have worked a lot on that. So I think that is all of our updates.
Thank you so much, Casey. We appreciate that. Next up, we have Louisiana. Anyone off from Louisiana with an update? Okay. Was there any other state that wanted to share any pertinent updates with us today?
I would share from Tennessee if there's time.
Okay, sounds good.
Hello, everyone. My name is Lori Hoffma. I am the Director of Operations at the Tennessee Community Health Worker Association. We have all of our programs are going strong, and we have a lot going on, but I specifically wanted to note we officially launched our membership campaign this week, which we have been working on all year. We were one of the recipients of a Southeast CHW grant to help us do that. And for us, that really means we've been working all fall to create communication networks because we had an informal email list. We now have a formal mailing list. You can now sign up for the mailing list on our website. The website has been overhauled and has a lot more functions. We have a membership portal where members can go backstage and create their and have materials for them. So we're extremely excited about that. We also launched a newsletter. We launched that in January with a little precursor to the membership. So all of the things we've been working on throughout the fall are coming. We still have a lot to do on the campaign. We're going to have messages going out throughout the next few weeks, and they're all planned. So we're pretty excited about that. And we're going to be launching social media as well. So all of those things needed to be put in place to launch the membership. So we're excited. Once we have all members, we have both individual and organizational membership opportunities. Obviously, then we're going to start creating spaces to meet and work together. The other thing I wanted to mention, there's other folks on this call that are part of it, but Tennessee CHW Association and multiple others in this group are part of a group called Prefer, which we are, this is a network that is putting, it stands for Partnering to Build Understanding of Genomics Responsibly, which is basically a genetics course for CHWs. We've been working for about a year on the curriculum, and we are launching our first cohort, which CHWs from everywhere, but mostly in the Southeast, are welcome to join. It starts on June 2nd, and you should have been, you should be receiving information about this. I don't know if anyone else from the group wants to hop on and say anything. We can certainly forward some information to get out to everyone at CHW at Southeast CHW Network. Again, it's a course that's going to start in June and go through July. It's going to be offered twice this summer, and then it's going to be offered again in the fall at different dates and times. And it's a 20-hour course for CHWs.
Thank you so much, Laurie. Anyone else would like to report out from their state?
Christiana,
right. Yes, Anna.
this is Anna from Arkansas. I would be remiss if I would not thank Allie and Lucas and Honey for all of their assistance in helping us get ready for our day at the Capitol. If it had not been for them, I don't know what we would have done. So thank you. I want to just give a shout out to them.
Kudos to you all. Absolutely. Thank you so much for that, Anna. I also put a little message in the chat. If you'd like to update your contact person for these monthly state updates, because oftentimes when I send out a request, I may not get any response back. So if you could just shoot me an email, quick email with that updated contact person's information, so that we know going forward who to contact. Thank you so much. Kim, the ball is yours.
Good morning, everyone, and thank you so much, Christine. So very quickly, we wanted to reach out again to see whether or not there were any suggestions for any meeting topics or speakers. I'm going to drop a link in the chat if you all would like to sign up for a month to be able to share with this community about your CHW related work, just like opportunities that many of you just mentioned. If you would like to share more, you may sign up for a month to be able to share with everyone. So please use that link and let us know if there are any interesting topics or people that you would like to hear from. And if you do suggest a person, if you could please provide their contact information if you have it, or at least give us enough information so that we can look for it. So that's that. And then we wanted to open up the floor if anybody else had any other updates that they would like to share.
Hello, this is Luis Lagos.
Hello.
I just would like to share that we have a Know Your Rights training in English today at 12 noon Eastern. We have been having, and by the way, my name is Luis Lagos. I work for Visión y Compromiso. And part of those trainings, Know Your Rights, they are bilingual. Today is in English, and tomorrow is they are in Spanish. I will post them in the link. But that Know Your Rights training tomorrow will be in Spanish. In addition to that, we have mental health and well-being training. Those are monthly trainings, and they are in English and Spanish too. This training came as a result of a survey that we did with some community health workers, promotoras at a national level, and they express the need not only for themselves, but for the communities that they serve about knowing your rights, given the anti-immigrant climate right now, anti-poor climate that we have in across the country. And second, they say we are experiencing like emotionally tiredness. So it is good that we take care of ourselves. In the survey, the result was the other need. They pointed out at this mental health and well-being. So thank you so much for allowing me the opportunity to share about this, and I'll post those trainings in a minute in the chat.
Thank you so much. We appreciate that. Anybody else have anything they would like to share? All righty. Well, I'm turning it back over to our facilitator, Sola, for closing remarks.
Okay, yes. Again, thank you, Rich, for your presentation. You provided so much great information and details that we need, and everyone else who put in links to get others in your state aware of what other information is out there. I'm putting again the link for my vision. I did see a lot of you join that channel, the Southeast Network channel. Amazing. And I'm so happy to see everybody and so glad that you and Louis, we're going to reach out to you because we want to learn more, even more of what your organization is doing. So thank you so much, honey. Great to see you. But yes, Louis just dropped a link into the chat. What I'll do is I'll take that link and I'll put it on the My Envision app for you. Louis, I'll put that on there for you. Thank you. Yes, great information. But if there's nothing else, I guess we'll wrap here. Is there anything that anyone wants to share? And yes.
Yes, one last thing I forgot. Thank you.
Uh-huh.
So our meeting next month is on March 18th, and we will have folks from the National Multiple Sclerosis Society who will be sharing about curriculum that they've developed with and for community health workers. So we encourage you to invite others to attend. As a gentle reminder, there is registration that's required to attend these meetings because there's certain information that we have to capture for our funder. So when you register, just remind some of your colleagues when they register, they'll get an email confirmation and then they will have to add the meetings themselves to their calendar invite as a calendar invite. So we look to see you next month on March 18th. Thank you so much. Thank you, Soledad.
You're welcome. Yeah, so if there's nothing else, I want you all to enjoy the rest of your day and your week. And please reach out if you need anything. And we'll be accepting some more folks into the My Envision app. I do see a few that just came in. And enjoy your day. Thank you, everybody.
Thank you, everybody. Bye. Have a great day.
You too.
Bye bye, everyone.
Thank you.
Bye.